Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, for wives-only seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. It's a beautiful Thursday evening, and we are on for another edition of the Amazing Power Woman broadcast. And tonight, tonight is the last Thursday of the month when we bring you the special Amazing Power Woman broadcast on Ask Your Gynae. And tonight, we have our resident gynecologist, Dr. Audrey Gugu Gamedze, on to bring us another exciting teaching, another enlightening teaching, another freeing teaching on the body of the woman. Tonight, she will be discussing menstrual cycles. This is one topic that every woman must listen to. So this is your opportunity to share this broadcast with a friend, with a sister, with a mother, with somebody out there who will be greatly benefited by the things that are going to be shared tonight. We have one of the best gynecologists in the city of Johannesburg coming to help shed light on that very important topic, menstrual cycles. Well, we're going to bring her on just now, and then when she's done, I'm going to come back and wrap up for today. All right, let's receive the ministry of Dr. Audrey Gugu Gamedze. Over to you, Dr. Gamedze.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Women broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
A special good evening to our viewers and to our listeners. Again, thank you so much for joining us this evening for yet another powerful session of the Amazing Power of Woman, brought to you by our pastors. Thank you so much, pastors, for giving me another opportunity to host this women informative session. Thank you so much. Today we are dealing with another popular yet very complicated and difficult to accept for other ladies topic. The title is the menstrual cycle. We're just gonna dive into what is it, what are the advantages of having it, the disadvantages of having it, what can go wrong, of course, after discussing what is the normal expectation around the menstrual cycle. So like any other good day, let's try to fix definitions into what we can define so that at least we know what is what. There is a misnomer that goes around that menstrual cycle refers to the period. A cycle is a continuation of events which we may not be able to put a beginning to it and an end to it. That is why we call it a menstrual cycle. So the days of the flow do not equate to a cycle. So I hear it very often when somebody comes in and says, I'm on my cycle, doctor. Every woman after puberty is on the cycle, whether you are flowing or you are not flowing. So the menstrual cycle refers to the start of the menstrual flow from this month up to the next flow for the next month. So on average, that is usually between 26 and 32 days. There are extremes where you can find that it is too short. So anything less than 26 days is a very short cycle, and anything above 35 days is defined as a long cycle. So on average, a woman goes for about 28 days in a cycle, 28 days. So the older generation used to use moons to qualify the menstrual cycle. So if we count the number of moons, it will be around 13. So that is why the menstrual cycle, if you add all the 2 days that stay behind when you count your 28 days, they will eventually give you sort of another cycle. So the menstrual cycle marks the maturity of the female. It marks the physiological and reproductive maturity of the woman. When is it expected to start? And when is it expected to stop? Somebody may ask that question. It is acceptable, or it is commonly noted, that most women will start their menstruation at around the age of 12, and they will stop at around the age of 51 and a half. Anything can happen in the extremes of those ages. So currently we are seeing our little girls having their menstruation starting at around the age of 9. That used to be previously taken to be abnormal, but we are seeing a lot of girls starting around the age of 9. So I think definitions are going to change based on that. And then we also see most of the ladies achieving their menopause around the age of 45. Traditionally, that was described as premature menopause, but now it's becoming common practice. So menstruation is expected to start between the age of 12 and stop at the age of 51 and a half. If you are late to have your menstruation, usually it is at the age of around 19. Then we say that is late. If by the age of 19, you have not seen your periods, you need to see your specialist to start working out as to what is the problem. If before the age of 45, you start achieving your menopause, still we need to work out to find out why your menstruation has disappeared so early. So the menstrual cycle has got two important limbs to it. We've got the ovarian limb, which is what happens in your egg basket. We also have the endometrial limb, which is what happens inside the uterus. The main seat of menstruation, or the control center, is the brain. So if you were to be headless, the eggs and the womb would not know what to do. So for ladies who have had major injuries that have affected the brain functioning, you find that they either lose the menstruation or they have menstruation that is without control. I would briefly like to show you a small diagram of what is the ovarian limb of the cycle and what is the endometrial limb. So this part will be what happens in the ovary, which is the eggs, and this part will be what happens in the womb. So relationship-wise, that is how it would look like. So this part is the womb, and this part is the egg. So those are the main seeds for the for our hormonal functioning as women. So the brain usually sends a message. Once you reach maturity, it sends a message to your eggs to say, dear eggs, please make sure that you are matured and you get released. And then when that message reaches the ovaries, the womb will be listening that what is the next instruction. Then the instruction will come from the eggs now to the womb to say, please prepare a mattress. There is an egg that is coming. The main reason for us achieving the menstrual cycle, number one, it is for hormonal maturity. And number two, it is for reproduction. So women who do not have a menstrual cycle that has started may not be able to conceive. Secondly, they may not achieve the secondary characteristics of maturity, that is the breasts, the hair, and the ability of the hormones to transit now into what will be the end result of signaling towards fertilization and having a baby. So having said that now, what is the correct number of days that can be achieved for menstruation in the menstrual cycle? And also, if that is not happening, does that equate to something wrong? Let's answer the first question. The menstrual cycle usually has phases, which is the menstrual phase now, where you are actively bleeding. And then there is also what we call the follicular phase, and also we have the luteal phase. Oh, that sounds so scientific, but it's very easy. To break it down, the menstrual phase is when you are flowing. The follicular phase, it's when the body is electing an egg. That egg is the one that is going to assist now to form a baby if fertilization occurs. The luteal phase, it is the side of the cycle where now the egg that has been released is being supported by the body to make sure that it achieves its intention of release. The mid-cycle, it's what is called ovulation. So most ladies will know the menstruation, they would know the ovulation. So ovulation, usually you may feel pain around the time of ovulation, and it is common nowadays that little girls will have extreme ovulation pain. That is due to the hardness of the capsule or the hardness of the cover of the basket. So if the cover is very hard, you will get extreme pain around ovulation. And that is also helpful for the ladies who are using the rhythm method of contraception to know that it is the time of the month where they need to be extra careful. Otherwise, ovulation is supposed to be not that painful that you may be grounded, you don't go to school or you don't go to work. Then the menstrual cycle, on the menstrual cycle, the menstrual phase is supposed to be anything between 2 to 7 days. So most women will have an average of about 5 days. The first 2 days being light, the last 2 days being light, and the midday being very heavy. So having said that, we have ladies who are heavy flowers, we have ladies who are moderate flowers, we have ladies who don't see a lot of menstruation, they've got scanty menstruation, and we have ladies who do not go for menstrual flow. So what can go wrong in the menstrual cycle? Okay, with the menstrual cycle, what can go wrong? Number one, it is inability to elect an egg, raise it, and ovulate. That can be inability number one, or that can be a crippling factor number one. So those ladies who do not ovulate at all, the outcome of that will be not having menstruation. So those ladies are called amenorrheic. it has happened that you find that somebody has started having periods and then somewhere along the way they disappear. So that is called an ovulation. So you are not ovulating. That is correctable as well with medical assistance. The second part of the abnormality that can happen, it is heavy flow. So heavy flow happens exactly on the menstrual phase. Heavy flow can be defined as extended flow, as in the number of days, more than 7, or heavy flow as in you're still within the number of days, but the amount of linen you use around that time is a lot. That will be heavy flow. So heavy flow can be as a result of hormonal changes, can be as a result of obvious lesions that are in the womb causing the heavy flow. We are having sessions that are scheduled in future where we will be discussing individual causes of heavy flow, individual causes of no flow, individual causes of scanty flow. So we will go through that. But for now, I wanted us to just have an understanding of what is menstrual cycle. Okay. So there are instances as well where you find that there is scanty flow. This month you have your menstruation, the next month you don't have, the following month it's 2 days, the next month it's half a day, like that. So disease conditions that result in that particular setup are also going to be discussed in future. In that setting, you also need to have medical attendance. That can be due to hormones, most of the time, hormones that are triggered by diseases like polycystic ovaries, where you do elect an egg, but it doesn't grow to pop out or it doesn't grow to ovulation. So in that way, you find that you've got a lot of eggs that are arrested in the same stage of growth, and those eggs are not being are not being ovulated. So that can affect the overall endometrial environment, hence difficulty of the body knowing when to start menstruation or when to stop menstruation. So those are the common abnormalities that are prevalent in the cycle. When it comes to menstruation, when now we come to the luteal side of the cycle, that is now you have ovulated, your body is waiting to see whether that ovulated egg becomes a human being or it becomes a menstrual flow. The cyst or the egg, the place, the area where the egg came out is supposed to remain active until the fate of that released egg has been decided. So if the fate of that released egg is being decided, that place can close in. When it closes in, it makes what we call a cyst. Because I am a specialist in my field, when you look at that cyst, you can tell that this is a luteal cyst or this is a follicular cyst. If you are doing a laparoscopy, a luteal cyst will even look yellow. It will have a yellow substance inside. That means that the area where the egg was released happened to close in and the patient is now having a cyst. So most of the ladies are getting diagnosis of cyst. You've got an ovarian cyst. It's a cyst. It's a cyst. I'm scared of cyst. That's a common statement that I hear. Why are we seeing so much cysts nowadays? Or why are our ladies affected by ovarian cysts? The commonest answer to that is that we are doing a lot of surveillance, number one. Number two, we are doing a lot of ultrasound diagnosis, which was not the case before. Number three, women are seeking a lot of health attention around their menstruation, or around their menstrual abnormalities. And then hormonal abnormalities, of course, which may be brought about the kind of diet that you are on, or may be brought about stresses that are now unique to the modern age woman. Let me make an example. In previous generations, women were confined to household work. Nowadays, they are in the boardrooms, they are exposed to the same stresses that their male counterparts are having. So those have got a main effect on your menstrual cycle as a woman. So the other thing that we have experienced as a common abnormality, which now may be related to any phase of the menstrual cycle, is menstrual pain. There are women who get menstrual pain during the flow. There are those who get pain at ovulation. There are those who get pain outside ovulation. So that pain is commonly called dysmenorrhea. Dysmenorrhea can be associated with the flow. It can be associated with ovulation. It can be associated with the luteal phase, which is outside ovulation. The commonest culprit around that is just dysmenorrhea associated with the flow itself. Prostaglandins or pain regulators, pain substances are commonly implicated in that. Secondly, you may get endometriosis, which is a common, very, very common occurrence in our generation. Of course, we don't know, is it because we are now having ways of diagnosis, or it is because now we are doing more laparoscopies to have definitive diagnosis or not. But we found that it's very common and it is affecting a lot of our young children. Some of them, by the time they are 14, they have got full-blown stage 3, stage 4 endometriosis. So that, unfortunately, is a lifelong condition. It's crippling our youth. It is responsible for a lot of infertility. It is responsible for a lot of loss of income. It is also responsible for destruction of marriages due to infertility. So I feel that that is one of the biggest spiritual attacks that we have in our physical bodies, endometriosis. Very difficult to diagnose at a glance and also very difficult to treat. Most of the treatment modalities are in such a way that they ease the pain, but they don't arrest the progression of the disease. If the progression of the disease is to be arrested, that will be from multiple operations done on the patient, which also reduces significantly quality of life and the economic outlook of the patient. So most patients with very severe forms and stages of endometriosis, you find that they are out of employment because every time around the periods, they will have to take some time off, and that cripples their economic outlook. Okay. So now that we have discussed what is menstruation, we have discussed what is normal, we have discussed what can go wrong. If I've got a problem with my periods as a woman, if I've got a problem with my cycle as a woman, what can I do? Levels of care, they vary. Let me start with home remedies. It is known that if you take Panados for pain relief, that can work. If you use a hot water bottle, that can work. If you use a patch, that can work. If that has failed, we go and we see our GPs. Our GPs, they can put us on stronger pain medication. If that doesn't help, we can also go on contraceptives. But if you are in a window where you desire to have a baby, that is a slightly complicated mode of treatment. So I would say from a specialist perspective, treatment of menstrual abnormalities or menstrual pain or whatsoever the main complaint may be is related to the cause. It is very important that before you start any form of treatment, you get referred to a specialist care where one can be able to find out what is the cause. In the absence of the cause, then oral contraceptives, which is the pill, is usually the mainstay of treatment. Why are we using the pill for everything? It's like domestos, it fixes everything in the house. The reason why we use the pill for everything, to control menstrual pain, to control irregular periods, to control heavy flow, it is the ability of the pill to have a hormonal manipulation on the body. So it helps also that the body takes a break and you use the hormones that are in the pill. Whilst the body is taking a break, it's got time to recover and recuperate. So the main fear for most parents or for most women is that excessive use of the pill can result in difficulty falling pregnant. No, that's not the case. Actually, the pill is very kind because it in the body, it lasts for as long as around 24 hours. After 24 hours, it is out of your system. That is why if you miss out on the pill and you expose yourself to intimacy, you are most likely to fall pregnant. Unlike the injection, which gets deposited in your body and it's gradually released, that results in a longer duration to return to fertility. So I have said that from a specialist perspective, we like to know what is the cause of the menstrual abnormality. The main reason for that is because some of these causes or most of these causes are treatable. So if we were to treat the cause, the menstruation will return to normal. Let me make an example. A 14-year-old comes and she has got heavy flow. In that case, the usual thing is that the body is still adjusting into ovulation, resting, ovulation, and resting. So usually most of those cycles are anovulatory. That means that that young girl is not actually releasing eggs. She's not releasing eggs, but she's having the endometrial flow. So with that, we can be able to regulate that part of the cycle. And then if it is a mature woman who comes in with heavy bleeding, you may find that she has got fibroids. And if we remove the fibroids or if we treat the fibroids in whatever manner, that kind of an abnormal flow gets resolved. Then if a lady comes in, she has not seen her periods for about 2 months, 3 months, her pregnancy test is negative, and that lady, we can do some tests, and most of the time, you find that she has a tumor growing in her brain. That can be a very small tumor that can be treated with medication, or a big tumor that will need her to be operated. In that way, the cycle is restored. So I always insist that if you see any abnormality in your menstrual cycle, whether small or big, make sure that you go to your nearest doctor and you do ask to be referred to see a specialist, just so that if it is a problem that can be solved, it can be caught on time and it gets sorted. So it's very, very important. And then also, if it is a problem that needs to be sorted out over a period of time, that can be done. What are the extremes of treatment outside what I have spoken about? In some cases, you find that a woman needs to be taken out the lining of the womb. That means that the endometrial lining needs to be removed for her to have a regulated or a minimal flow. We call that endometrial ablation. It is a very common procedure for women who are around menopause. Hysterectomy, I for one, I feel that every woman must go to the grave with her womb. It is hers. So I am generally not a fan of hysterectomy. I always feel like there's a lot that can be done before we get to hysterectomy. There are some doctors who will say it's your eggs that are a problem and they take them out. Please make sure that you do proper consent with your doctor so that you understand the advantages and disadvantages of removing the eggs. Remember, I said that the eggs are the seat of your hormonal practice as a woman. So if the eggs have been taken out, you might find yourself now not aging gracefully because the hormones have been removed. So let's try and put a summary into this so that we have an understanding of what is it that we were trying to achieve from this talk today. It is about the menstrual cycle, that the menstrual cycle is expected to be at least around 28 days on average. There are extremes, and that by the age of 18, 19, a woman must have started menstruation, the earliest being around between 12 and 19. And also by the age of 51 or the latest 55, a woman is supposed to have stopped menstruation. If there is a change in what you know around your menstrual cycle, please don't wait or self-correct at home. Seek medical attention. The worst case scenario, if the womb needs to be taken out, please make sure that you understand why it has been taken out. The incidences or accidents of delivery where you find that the baby needs to be delivered and the womb needs to be taken out, no matter how young that woman is, she will not be able to see her periods. So if your periods disappear and you are unsure why, please do seek help so that there is clarity. Lastly, there is treatment or there is something that can be done for any of the abnormalities that we encounter in our menstrual cycle. Again, thank you so much for joining us on this talk. I promise that in the next time, we will be breaking down now what causes what in the menstrual cycle. God bless you. Let's continue being amazing in our womanhood. Thank you so much.
Wow, 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 wow. Dr. Gameze, thank you once again. Thank you for your heart. Thank you for your expertise, for your knowledge, for your genius in helping women and understanding their bodies. Thank you for a wonderful teaching tonight. We are very grateful. Well, my dear sisters, whatever it is that you have received tonight, you need to share with somebody. Somebody needs to learn what the things that you have learned today. So share this video, share this teaching, copy this link, paste it. If you are in groups, WhatsApp groups, share this link. Somebody will be, sending you thank yous and sending you flowers and sending you, gifts to appreciate you for helping bring light into their life in this one subject that is very important to all women. Well, it's been a beautiful one tonight. We look forward to another edition next month for another Ask Your Gynae. Until then, keep sharing these files. Let this link go, let it go far. Let it reach everybody around you. And let's stay enlightened. Let's stay empowered. Good night. God bless you. Bye-bye.